rapids. But as I said, most of it is caused from UV radiation, but it's accumulated damage over time. You don't go to the beach on a weekend, get sunburnt, and wake up Monday with a melanoma. It basically is a progression over time, and of course, you know, cancer of its own is a good cell that's gone bad that then affects other cells. So there's different types of radiation, obviously UVA, UVB, UVC, and the relevance really for that, I mean, UVC, thankfully we've got the ozone layer that protects us from most of that, but this is where sunscreens will become important, because some of them are UVA and some of them will protect the UVB. The fact is you need to protect against both. The different types of skin cancers. So basically, the basal cell carcinoma, which is about 74% of all skin cancer, is the most common. It is unlikely you will die from that. In fact, it's almost impossible. The squamous cell, so just sort of explain it, melanoma is at the top, and that's 4%. So it's very small, but it's very aggressive. Then you have squamous cell carcinoma, or SCC, that's called the mid-level cancer. That was that lady that I referred to earlier, what she died from. And then there is basal cell carcinoma. So basically what it is, it's just the different layers where obviously the cancer sits. Now, the key thing is this, melanoma tends to be a burrower. So what does a cancer do typically? Obviously, it gets into your lymph system, secondary infects, and that's when you're in trouble. Now, the thing with the basal cell carcinoma, it's a slow grower across the surface, it doesn't really burrow. And squamous cell carcinoma is now going across the surface but it's burrowing down. Melanoma is pretty much, you know, a burrower, if you want to sort of, you know, distinguish between the three in a very simplistic way. So basal cell, very common, lots of people have them. This is the one that, as I said, the vast majority of the populace have. You're not likely to, but it's just going to be disfiguring, and it's just going to be, if you leave it longer, it's just a bigger chunk of skin and probably a slightly larger scar you'll end up with. Squamous cell left unattended, you know, can obviously be lethal. And I think the key thing with skin cancer is not, you know, the round black thing, you know, it's not that easy. I mean, they can be pink, purple, you know, brown, black, you know, they can be of any colour. In fact, one of the most dangerous ones is what they call desmoplastic, which is almost clear, so it's very difficult to see. But, you know, the key thing is with skin cancer, it is, you know, a surface-based thing that is growing or changing. So if you're sitting there and going, that's new, I haven't seen that before, or I think that is changing, my advice is you to go and see a doctor and get them to have a look at it. We'll talk a little bit in a moment about what they should be doing. I'm going to give you a few hints as to what the profession probably should be doing. I'm conscious of being filmed, so I'm going to be careful about what I say in some respects, because it is the medical profession. But look, I suppose I'm just very conscious of the fact that this stuff is very, very, very common. As I said, two-thirds of us in this room will be treated for skin cancer. So, you know, if you do have something you're not sure of, or on your partner you're not sure of, and I think one of the big challenges is this. I mean, I can see this bit of me, but I can't see this bit of me. So unless someone is looking at that bit of you, as in your partner, and it's got an attentive eye, my advice would be to go and see a doctor on an annual basis and get them to have a look. I mean, we've had a classic recently in a practice in Phoenix, Arizona, that a patient came in with this thing on a temple, which was a seborrheic keratosis. No, it was nothing, but, you know, it looks a bit nasty. You know, patient was just there for this, didn't want to get undressed. You know, the medical assistant, which is, you know, a PA effectively for a doctor in America, convinced the patient to get undressed. The patient eventually complied begrudgingly. She had a melanoma on her back. So, you know, we have stories like that, and we sort of share them with people, and people go, okay, well, maybe I do take my shirt off to have a look at it. But the key thing is that the general differences between skin cancer, and then of course is our good friend, this one. Now, melanoma of itself, as I said, you know, the most dangerous, well, the most common ones that people die from are nodular melanoma. In other words, they actually become a nodule, which this picture probably doesn't do justice of what that is. So if you do have a pink nodule of any description, and it's not a pimple and you're not 15 years of age, you would need to get that have it looked at, because that's the most dangerous one of all. Really, when we teach doctors about how to diagnose skin cancer, what we're looking for is, you can see with this picture up here, it's got this irregular border and it's, you know, more than one colour and all this sort of stuff. That's the sort of thing we're trying to teach a doctor to be able to look at and go, well, a mole is very clearly one colour and generally, you know, symmetrical. skin cancer is asymmetric and typically will have more than one colour. So to be able to differentiate between clearly nothing, don't worry about it, and clearly doesn't look right to me, is not overtly difficult. The key thing is the doctors need to have a handheld magnifying device, because of course standing back looking at it from here it just looks like a little pink thing, but when I blow it up and have a look at it closely, it'll give me more information to be able to make a diagnostic decision. Skin cancer prevention, I mean, we're very fortuitous. As I said, we're probably the most educated populace on the planet when it comes to this. In Germany they have pop songs and different other methods they try and get through to the market with relation to being skin cancer aware. I think the difficulty is, of course, is that none of us want to think we're going to never be sick. But the key thing, as I said, is it is very preventable in as far as, as I said before, I mean, you could walk around under an umbrella, do all the right things and still die of a melanoma because it's genetics of some part. In fact, the story that I generally will tell people also is that, what did Bob Marley die of? It wasn't, smoking too much pot or, in a gun battle with nasty people. He died of a melanoma on his foot. So, it does happen in darker skin types. It's just less common, and they actually tend to have them under the nails and on the soles of their feet. So, they're the areas we pay more attention to when we're screening people, as I said, with darker pigmented skin. But the fact is that, you have a natural burn time of about 15 minutes, right? And it depends, once again, what part of the country. If you're in Tasmania, it's longer. If you're going standing up north, it's a little bit shorter. So if you are going to spend more than 15 minutes outdoors in the sun, you really should be, obviously, at sunglasses, etc., and sunscreen. And I think that the key thing also with sunscreen, a lot of people say, well, I went to the beach and I still got sunburn. And that's generally because they went to the beach, put out the towel, got the esky out, had a bit of a play, then decided to put on the sunscreen, and that's now 20 or 30 minutes later. So they put the sunscreen on, the damage is already done. To really actually apply sunscreen properly is actually to apply it before you walk out the door, not when you're actually there doing that activity. So, my place, it's in a pump pack next to my toothbrush and everything else, if I don't play golf or going outside to consume the sun. There's also a lot of debate around vitamin D versus skin cancer. The argument is, well, if we protect ourselves too much, we don't get enough vitamin D, and vitamin D you do need for bone strength and for cancer prevention. So we have this wonderful debate about how much is enough and how much is too much. Effectively, as I said, 15 minutes exposure to the sun is all you need for your vitamin D requirements as far as what your body's required. But as I said, if you are going to go out in the sun for an extended period of time, please, do take preventative measures. Otherwise, you're going to be one of those patients we get to do procedures on at some point in the future. As I said, the key thing about applying sunscreen also is this. A lot of people sort of sit there and try and get something the size of a 5-cent piece and try and spread it out as thinly as they can. Unfortunately, you need to lather yourself a little bit more. Otherwise, it doesn't work effectively. So, as I said, basically the sort of recommendation is 1 teaspoon per arm is sort of a general guide as to using it. And look, and sunscreens, not all products are the same. It's like anything, the rubbish in the supermarket is generally not complete rubbish, but let's say it's not of the same quality as something that's obviously manufactured by a company. That's all they focus on. So, I mean, as far as a product that I would be using would be Ego, which is SunSense, or Hamilton's, which are both Australian companies, purpose-built design products, versus the large pump pack and Coles that's been pushed out of a machine. Not saying that, once again, something's better than nothing, but if you really do actually care about yourself and protecting yourself, I would advise to spend a couple of dollars more and actually have the right product for you. Sunscreen also, a lot of people sort of saying, well, I don't want to apply it because, it feels all oily and all that sort of stuff. The sunscreen manufacturers know that. They now have products which are matte. They've got stuff that's got foundation in them. There's all these different ones. There's spray-on ones. I mean, I've actually developed the technique of applying sunscreen without putting sunscreen on my hands, so I can play golf. There's nothing worse than putting on sunscreen and having an oily hand. So there is a method of doing that. Maybe one day I should film it so I can share it with you. But effectively, you're using the inside of your forearm as your actual method of applying it, to not put it on your hands. But I suppose my key thing is that, do use it routinely. Don't use it just for the time that you're out in the sun for 4 hours. You get enough available sun just from the sun reflecting off the bonnet of your car as you sit in the car. So